Hi, I'm Dr. Laura Lubbers from Handa Microsurgery Associates. We have a group of 5 physicians who are on call 24 hours a day, 365 days of the year to take care of hand trauma at Riverside Hospital. We have been an established group for more than 20 years and have over 100 years of hand surgery experience within the group. We see cases of complete hand amputation approximately once or twice a year. How salvageable they are depends on the extent of the injury. For instance, in Pat's case, it was despite the fact that it was a saw injury, it was fairly isolated in terms of the width of the injury, and there was no injury distal to the part. When it really boils down to it, the surgery is only about 50% of the actual result. The other 50% comes from the aftercare and the hand therapy provided by a specialized hand therapist to make sure the patient comes along at the proper pace. If you don't move them, everything gets stuck. If you move them too much, everything gets torn apart. So we have to find that one little space in the middle where we have the patient doing the right amount at the right time. And as it gets stronger, we can add more force along the way. When it comes to Pat's case, in terms of choosing what procedure we're going to do, we have to make the big decision. Are we going to let this remain as an amputation and close it and provide a prosthesis? Or are we going to do a limb reattachment and go for a functional hand that's certainly more anatomic and usually more functional? It's difficult for us. We only have a certain amount of time, for instance in Pat's case, where we can reattach the limb. If it has muscle in it, which all forearm level amputations would have, we only have about 6 hours from the time of the injury to reestablish blood flow. If it's cooled, if the part is cooled, we have almost 12 hours. So our practice draws from nearly every county in Ohio and also from surrounding states, and people also come from outlying states for our care. But it all boils down to focusing and narrowing in on each little thing you do, each thing you're repairing, to make that as perfect as possible. And then when you sum that up, you can get the whole hand working quite well. As I said, a lot depends on the patient's attitude and cooperation. The best surgery in the world for reattaching a hand will not get a good result unless the patient completes the second half, that is the rehab. It's also one of the most gratifying aspects of hand surgery. You know, we save people's careers, their functional life, their ability to work, the ability to go have fun at their avocations. Everything you do, just about you do with your hands. So fortunately, we have a tremendously high percentage of successful results given the group aspect that we have towards managing patients, and we can very consistently get a good or excellent result in most cases.